Day set aside to celebrate them, and we are happy to warmly welcome you to the 2026 World Blood Donor Day with a beautiful theme, One Drop of Humanity. Give blood, give blood, give blood. The DJ, can we...
Our international partners, the WHO, our local partners, so numerous to mention. We have AAA, a lot of them here. Donors who altruistically give blood without thinking of anything in return. Donors who give blood to save lives. The theme for this year is One Drop for Humanity, Give Blood, Save Life. It is actually apt, it is appropriate, and it is well crafted to suit what the whole blood donation is. We're very happy to have our international partners here, because without you, we wouldn't have been where we are. WHO, you have done excellently well for us, giving us the technical advice, assistance, strategies, and so many other things. The DG of National Blood Service Agency, we thank you very much for all the good things you've done. And to all our donors, because we are celebrating each and every one of you. Today is your day. Today
of the press, distinguished invited guests, partners, and all our dignitaries and donors. Good morning to you all. All of us are surprised that we didn't see him here today. I'm sure all of us will be surprised. He has always been at the forefront of all our activities. Unfortunately, there was an urgent invitation this morning, and he has to go there. And it was actually very, very, very important. Ladies and gentlemen, it is my great pleasure to welcome you all to the 2026 World Blood Donor Day celebration. Today, Nigeria joins the global community in commemorating an occasion dedicated to recognizing the invaluable contribution of voluntary, non-remunerated blood donors, whose selfless acts sustain the health system and save countless lives every day. This annual observance also provides an important platform for strengthening public awareness on the critical role blood donation plays in achieving universal access to safe blood transfusion service. This year's theme, One Drop of Humanity, Give Blood, Save Lives, aptly captures the essence of voluntary blood donation as a profound expression of compassion, solidarity, and collective responsibility. It reminds us that every unit of blood represents hope for patients facing life-threatening medical condition and emergency. So blood transfusion has been recognized as one of the very fundamental pillars, and a lot of resources are being committed and will continue to be committed to blood transfusion. I won't end this message without talking about the recent achievements that the agency has been recording, all in an attempt to promote and encourage and enhance blood transfusion services in the country. It's on record that our pool of blood collections are actually almost double between 2024 to 2025. And this year we are expecting more. Thanks to the new policies and the cooperation of all the hardworking and diligent staff of NBSA. So we thank you very much, and will be digitalized completely so that both for the donors, the recipients, the doctors, and whoever is involved in the chain, you don't need to do any paperwork. You just go on your system, on your phone, at one click, you get your blood type, and it can be delivered to you wherever you are in Nigeria.
WHO representative to Nigeria, and also on behalf of our Africa regional office, and also the WHO office headquarters in Geneva. Let me read quickly a 1 minute speech. On behalf of Nigeria, in commemorating this World Blood Donor Day 2026 under the inspiring theme, One Drop of Humanity, Give Blood and Save Lives. As we know, across Nigeria, thousands of patients, they require blood transfusion every day. The women experiencing complications during pregnancy and childbirth, the children suffering from severe malaria and anemia, the victims of road traffic accidents, individuals undergoing the surgery, and patients living with chronic conditions all depend on timely access to safe blood. So access to safe blood and blood products is not just a medical necessity, but it is a cornerstone of a resilient health system and an essential component of achieving universal health coverage and health security. WHO recommends that countries collect at least 10 blood donations per 1,000 population. And I congratulate Nigeria because in last 2 years they have doubled this blood donation from in last 2 years. But we also need to emphasize on regular, voluntary and unpaid donors as a safe source of blood. Special tribute to Nigeria's voluntary blood donors. Your generosity embodies the spirit of compassion and solidarity that sustain communities. You are a silent heroes whose contributions save lives every day.
It is our pleasure this morning as APIN Public Health Initiatives to be part of this program, the commemoration of World Blood Donor Day. As APIN, we've come a long way with National Blood Transfusion Agency, right from the day of when they were just a project, working with Save Blood for Africa Foundation, and progression to when they became a commission. We were part of the struggle from the beginning, ensuring that taking the message of blood donation is very, very critical, and ensuring that we have voluntary, non-remunerated donors. As it stands today, it is still going to be, despite all the work we've been doing, we know that we still are short of blood in all our facilities. And we know a lot of people that have life-threatening conditions need blood. It has already been enumerated clearly by WHO representative. I won't go over that. And it's something that all of us need to, pay attention to. And no little wonder that this day is the secondary school blood safety club, a group of students who we are catching young to ensure that they understand the message of blood donation. And we all know when people are conscious that they are blood donors, it keeps them away from high-risk activities. So APIN has been consistently supporting this blood safety, secondary school blood safety donation program, which involve at least 30 schools.
Moving to communities, mobilizing blood donors to see that we bridge the gap of inadequate supply of safe quality blood in our blood banks. And to the heroes, those are the real heroes, the blood donors. These are heroes without capes.
Strengthening Nigeria's blood system through digital innovation, improved coordination, and enhanced traceability through the blood value chain. Together, we remain committed to the NBSA in ensuring and supporting safe, accessible, and quality blood services nationwide, while promoting a culture of voluntary blood.
To ensure safe blood is given to our people. As a hematologist and also one of the NBSA staff, I think this is a very important project for us, and we'll continue to partner with each and every one of you. Thank you so much.
Stand on the already existing protocol. So like they say, my name is Shalom. I'm also a nurse by profession. From Health Foundation started this journey of advocating for blood donation and partnering with National Blood Service Agency. Just like this year team reminds us that every single act of kindness can save life. Every unit of donated blood represents hope for the mothers during childbirth, cancer victims, children battling illnesses, and patients undergoing life-saving treatment. At Shalom Health Foundation, our mission is simple: to improve access to quality health care through medical outreaches, health education, advocacy, and community engagement. We believe that safe blood is critical component to healthcare delivery. Today, we call on individuals and organizations and community to embrace the culture of regular voluntary blood donations. And we appreciate the National Blood Service Agency and all the partners for this impactful collaboration. Let us continue to spread awareness and inspire more people to become lifesavers through blood donation. Thank you, and remember